Hello, this is Claire Phoenix. I'm here at Food Ingredients Europe and I'm here with Stephane Postic. He is the CEO of Nature Alpha. Stephane, can you tell me about your work and you help people with clinical trials, I believe?
Yes, our main business is to run clinical trials for all the nutrition and health topics.
Yes.
We've been working over the past 12 years in this field, and we've been running first. We also help our partners with building their R&D programs with some consulting activities to make sure that we decipher well the main objectives of their R&D programs and make sure that their clinical study is appropriate, because budget, of course, is something important for our partners, and also having precise timelines is something that they are looking at very carefully. So we make sure that we recruit in time and the correct population in order to address their real issues and make sure that they can finalize their programs in time.
And so how long does it take to do a trial usually?
It depends. It depends on the
but roughly
study.
2 to 6 months, a year, 2 years?
Yes, I'd say 2 to 3 months is a minimum. Up to 12 months is something common as well. Mm-hmm. And but it's really important to carefully look at the population you need to recruit and make sure that the study doesn't last too long.
Because that's what happened with EFSA. They weren't happy with some of the targeted populations, that they weren't accurate for the type of dossier. Is that correct?
Yeah, that's correct. We need to. We discuss a lot with our partners before starting the study, of course, to make sure that their final objective is the EFSA dossier. Sometimes we end up considering that it's not the right aim to look at and to aim at. So it's very important to have this first discussion with them.
And you work with big clients like Danone, Nestle,
yes,
like Bread.
We've been working with, I would say, 50 big European partners, because we have a very good knowledge, of course, of the European regulation. So most of the time we do business with European partners, also with non-European partners that are looking to enter into the European market, which is very important. We've been working with Japanese or Israeli companies also recently, because they wanted to commercialize their products in Europe, and they didn't know how to integrate the European regulation, so they come to us in order to explain to them what they needed to do.
That's very interesting. And the sort of products are anything from chocolate, fiber,
yes,
tomatoes?
All kinds of ingredients, food supplements, functional foods. The major health topics we are looking at are metabolic disorders and gut health disorders. Yes, we can, in our clinical center, we can easily recruit people with diabetes and obesity, because unfortunately in the north of France we have a lot of people with those types of problems. But it's a good thing for us, because we can recruit them easily for our partners.